Hello, welcome back to the Digital Orthopedics Conference COVID-19 Orthopedic Response, a production of the DOCSF team, the Digital Orthopedics team, and University of California, San Francisco. I am your host, Stefano Bini. I'm a professor of orthopedic surgery at the University of California, San Francisco, and the chair and founder of the Digital Orthopedics Conference. We are thrilled to be joined by the American Academy of Orthopedic Surgeons as a global convener to address and rapidly respond to the dramatic changes to healthcare patients and our communities. We're grateful to have a global audience and joining us this discussion. And I'm very pleased to welcome Molly McCarthy, who is an MBA, but also a nurse and chief nursing officer at Microsoft. She has 25 years of history working in the industry of healthcare and started as a NICU nurse. So very familiar with the challenges that many of our patients are dealing with as we speak. Molly, welcome to our summit.
Thank you. Thank you so much for having me. It's great to be here today.
I'm so glad you've been at Microsoft since about 2013.
I've been at Microsoft since 2013, so it'll be about 7 years in June. Most of my career I have spent in health tech, spent some time out in California and Silicon Valley working for a medical device company where I really transitioned my clinical work into product development, working with hardware, software engineers, but then also bringing in our clinicians to ensure that their voices are heard as we develop products. And I do have a roommate here, if you can hear him.
Awesome. He's right. Very welcome.
Give me 1 second.
Yeah, we got to say hi.
He usually sleeps, but someone's at my door. Anyway, so it's so great to be here today. And just wanted to thank you, Dr. Bini and Shauna, for having me back. I'm so excited to be here. I live right outside of Washington, D.C., so I'm joining you from my home, which you can see. I share my dog, but he just ran to chase someone at the front door. I do have 2 teenage boys and a husband who were instructed to be very quiet this morning. They are doing some homeschooling, so I do want to provide that caveat. And really just to thank everyone around the globe, our frontline healthcare workers, our nurses, our physicians, our respiratory therapists, the unit secretaries, everybody. I know I'm going to miss someone, but as well as those supporting us, grocery store workers, firefighters, etc., and really supporting us as we navigate this pandemic. As Stefano said, I've been with Microsoft for 7 years. And the interesting thing is, I just wanted to share with you, just so, it's Friday, so I thought we'd have a little bit of fun. Yeah, there we go. I have a little quiz for you guys here. And I have to tell you that I saw something similar to this online, but I've been working with organizations really for 20 some years, providers, practices, et cetera, and seen a lot of transformation and a lot of transformation, quite frankly. So as you reflect on where you are, I want you to think about today what has led to the digital transformation of your healthcare system, your organization, your practice, et cetera, and where we are today. So I just put some choices up here: Chief Executive Officer, patients, consumers. They always tell you to pick answer C, which is me. That's not correct. Nurses, doctors. So what
do you want me to create a virtual poll? I can do it in about 1 second. You can actually give an answer.
Yeah, that
okay,
would be great.
Give me a second. I'm going to do that for you. Who led the transformation, please? Okay, I'm going to make that brief because everybody knows. So CEO, patients, customers.
I originally had the whole C-level, but then I was like, let's bring it down to really who makes things happen in a healthcare organization. And So once you get that
What's
poll
the
going,
last one? Is it doctors? Is the last one doctors? I can't
doctors,
see.
yeah. I
Oh,
had
good.
surgeons in there, but I thought I'd be a little broader.
Yeah. Okay, got it. I think I have it up there. Everybody can now go to your poll session and you can vote. Let's give everybody about 10 seconds while we're talking. Please go down to the poll session and you should be able to see the poll, folks. And then literally just go poll there. I'm going to get a quick one. You're getting some polls coming through and some votes. And after a little while, these don't change very much. So what you're seeing a drive towards, it's kind of cool to see this go live, huh? Patients, customers, and doctors. So what's the answer, Molly?
The answer is none of the above.
Oh my gosh. Okay. Boy, patients,
The answer
customers, and
is
doctors
what's
will be
been happening
disappointed.
over the past 7 weeks. I've seen more transformation within organizations over the past 7 weeks than I have really in the past 7 years as a response. And, I think that's just a testament to everyone responding to the code, so to speak. And so today I'm going to give you a little preview of what I've been working on with different organizations, different practices. And keep in mind, my background, I did work as a clinician, but I've been in tech. So I'm going to give you the perspective from Microsoft and how we're really looking to help the organization as we navigate this, both from a technology perspective, but really, at the end of the day, human factors. So I first want to share with you a story about what happened in January back at Providence. So whether you're familiar with Providence Health System or not, I'll tell you a little bit about them. They are the largest healthcare provider in Washington State. They actually treated the first patient in the United States with coronavirus. If you have not seen or heard Dr. Amy Compton Phillips, I highly recommend going and listening to how they really put together a response that focused on communications, remote monitoring from telehealth, and then really outreach to the community. And you can go to their site. I'm actually going to hop over to their site right now just to show you their health bot. Her name is Grace. So just give me 2 seconds.
While you do that, Molly, let me explain to people what a chatbot is. It's a conversational engine that many of you have been using if you go on a commercial site. That could, for example, be Amazon, and you're looking to purchase a product and the software comes up and asks you, hey, I see we're looking for a hair dryer. Have you considered these options or something along those lines? And those chatbots are powered by an artificial intelligence engine that can read the text. So if you say, I want a hair dryer, I want a blow dryer, I want something to dry my hair, you'll always understand what you're looking for is a hair dryer. Okay, back to you, Molly.
Great. So when you go to the Providence website, and I will say that we had been working with them over the past couple years on just different initiatives, but they essentially came to us and wanted to create something that would help really decrease the burden on their clinicians, just all of the phone calls in, and wanted to create a triage process for patients to essentially enter into their system. So you can see it. This is their home page for coronavirus, and you can see the actual assessment tool right over here. And her name is Grace. So if you click on Grace, and actually if you click on, there are many systems we'll see that have the actual chatbot. It just kind of gives you a background, what terms of use, et cetera, any liabilities, legal information. And so I'm just going to say I agree. So the next question that Grace is going to ask me is, do I want to assess my risk or maybe my child's risk for coronavirus? Or do I just have specific questions about coronavirus that I'm tired of asking Google? So I'm going to say I'm going to assess my risk. So you can just see how it goes through a series of questions. And because Providence is regional to Washington State, they do cover quite a large geography. And so the only states that are listed here are states that are part of their system. So if you just, for example, if you select other, we can just see that it really only we only provide care to those states that I mentioned. So I'm going to go back and say, yes, I've been tested. Do I know my result? No. And really, we'll go through a series of questions. Have you been in contact with someone known to have coronavirus? Yes. So it goes through a series of questions that are really helpful, and we've seen really decrease the incoming traffic to hospitals, and really act as a triage. So I'm going to come back over to my presentation now and just share with you a little bit more about Clara and about Providence. And I'm trying to get can you guys see that? There we go. We good, Stefano? Yeah. So Stefano was beginning to tell you a little bit about what a health bot is. And we actually released our first health bot last March. It's been, it was in private preview. We were working with some systems, actually a healthcare system in Chicago, as well as a big payer organization, as well as a life science company. And so we're not restricted to one type of entity. And if you're familiar with the health bot, great. But if you're not, I am going to tell you a little bit about it. So it's really from Microsoft, what you saw with Providence. It's out of the box healthcare intelligence. It's based upon artificial intelligence. And really it's helping frontline organizations such as yours respond to the crisis today, but then it can be used in the future. For example, if you have a hip replacement patient like my husband was 2 years ago, and they have some questions, prior to surgery, while they're in their hospital stay, or even more likely after surgery. So what it does is we originally collaborated with Providence, and with that work, we actually presented this to the CDC. They actually came to us and said, how can we create something that would live and breathe on the CDC website? And really they came to us because of the work that we have done, because it can be customizable. So it can be, right now, hospitals can, or practices can come to us and say, we want the framework that's based on the CDC guidelines, and we're not gonna configure it anyway. And that's pretty straight out of the box. Or you might say, you know what, at the end of my self-checker, I want my patient to have the option to schedule a telehealth visit, or to check back in 24 hours, or whatever that decision tree may be. And so, like for Providence, they have the option of scheduling a virtual visit at the end of their checker. So every system is a little bit different, but it is customizable, is my point. But it's also can be used right out of the box. I know with Providence, we got theirs up and running in 3 days. We've had, last weekend, we got a call on Saturday from a children's hospital, and we had theirs up and running by Monday. So pretty quick turnaround time. We've spent hours and hours with organizations on this, as well as some of our other solutions. And the last piece that should not be overlooked is just Hipaa security compliance. And so I just wanted to let you know, we've got so many different certifications and compliancy regulations that we're part of. I'm not going to go out to the CDC website just yet. I am going to just continue on with the presentation. So you can see this is some screenshots of the CDC self-checker. And again, it goes through a series of questions like I showed you with the Providence self-checker, where it gives you the disclaimer and then kind of digs in a little bit deeper on what you're looking to do today. My husband told me he was feeling sick last Thursday. So I said, okay, we'll go do the coronavirus self-checker. He said, he came back to me, said he's only got one symptom. So I said, okay, we'll schedule a telehealth visit tomorrow. He's fine. But anyway, so I did refer him out to that. I think that, it's scalable on Azure. So it's very quickly easy to deploy, as I mentioned. And someone asked me, do you have to be a Microsoft customer? Does your healthcare organization have to use the cloud? Or is it something they can build within their own data center on their on-premise, we call that. I mean, and really it can be done either way. And we're working with organizations really to get this up and running for the next 6 months at no cost. So I wanted to mention that as well. Our goal is to help as many organizations, as many nurses and physicians as really humanly possible. I do want to show you a little bit more about the generic bot, just so you can get a feeling, especially being in the orthopedics. My example is actually a pediatric example. I spent a lot of time in pediatrics, but you can see as it is configurable. So this was actually built on a protocol within a pediatric hospital, and we can go through the actual the bot and the questions. So you can see here on the right side that the bot intelligently identifies the context of the problem, even though they've misspelled headache, and it gives like a scale of what, how could you describe the headache? Maybe it's something, it could be something due to incision, for example, and it maneuvers through, and it has the ability to have that parent check the symptoms that they have. So for example, I'm going to check off photophobia and neck stiffness. And so then it routes through, again, based on the hospital's protocol, their policies and procedures, what exactly has to be done. And then at the end, it gives suggested next steps and possible causes. I'm just going to scroll through this quickly. So again, I have so much information for you guys today, but I know our presentation time is limited. So really quickly, I did want to mention that our goal is to help you reach your patients, communities, and clinicians, and that the HealthBot was one of the first tools that we deployed in response to the COVID-19. It's something that, as an orthopedic practice, as a hospital, you can easily put up on your website, as you saw with the Providence system. We're actually live in many systems: Novant, Humana, Swedish, Children's LA, multiple languages as well. Obviously, that's important. That's not a problem. We translate into many different languages. I know the one in LA was the first one that was in multiple languages. So the other thing that we have, as I mentioned with Providence, is they actually, at the end of their chatbot, they route folks to the ability to schedule a virtual visit. And that, our system integrates with whatever system you might have for virtual visits. Maybe it's Zoom, maybe it's Teams, maybe it's, Teledoc, whatever that may be. We have the capabilities through our Azure API Fire to do that. So I wanted to mention that as well. The other thing that we're coming out with that is actually went live last week is virtual rounding with Teams. And I think that's important because as we know with COVID, you might have a person with multiple comorbidities, but you also might have a person who has family who can't necessarily participate because they're across the country, or quite frankly, they're just not allowed into the hospital. So we do have virtual rounding with teams. Many different institutions are actually already live with that. And then the other thing that we recently launched, which we don't really have time to go in today, is our crisis management. And this is really looking at data tracking and analytics, including information like supplies, PPE, ventilators. So that's something that we've worked on as well with organizations. And again, I don't have a ton of time today, so I wanted to provide you with a couple different resources. The first here is just, you can go out and you can, I have the link down here, but if you just put in, even if you put in Microsoft HealthBot Service video series, it's a really quick 3-minute, they're 2 segments. They're each 3 minutes. My colleague actually put them together, a deeper overview of what we actually offer and how to get in touch. We have a whole tech site that has all of the different services. You can see it right now. This is actually something I recommend you do with whoever your preferred tech partner is to go out and join. We actually have a community that anyone can join. I actually joined it last night just to show you guys. And in our community, we actually have all of our different resources and what our COVID response is and what we're doing to help the organization. So you can see right here in the screenshot, the emergency response data tracking system. So and lastly, if you haven't had the opportunity, I highly recommend, wherever you are in the world, again, this particular webinar took place on March 2nd, so pretty early on, with Dr. Amy Compton Phillips. It's really a great overview of how they were able to put a multi-pronged strategy together for the response. And then this is just some additional resources. I know we have folks from around the world. So these are just links to different organizations, and by no means is this list complete. We're actually adding them multiple cases a day. And EMEA is just our abbreviation for Europe, Middle East, and Asia. So we work around the globe, and we're really excited to potentially work with some of you as we look to really help decrease and flatten the curve. So thank you. And I'm happy to share the links. I'm happy to share the presentation, whatever, Stefano, you think would be most helpful.
Outstanding. Let me just come online. I have a couple of questions for you. Let me just do this real quick. Bring us on. I'm going to X out your presentation. It'll be just 2 of us. And one of the things that we have a few minutes to get into, because the chatbot is really an interesting tool. And later today, we'll be hearing from the UCSF team that deployed a chatbot, but not in this traditional way to ask questions. We actually use it to screen all healthcare workers before they come into the hospital, meaning that you have to take it on the way into work. Right. And then you have to show at the front door what the outcome of that question was before you let in, or you have to do it manually on a piece of paper. So that's been useful. Clever idea of repurposing the same technology to a different outcome.
Yeah, that is, and that's a really good point, because it's not just the patients and clinicians, but really it's the employees who are at risk for transmitting, or at risk for actually getting COVID. And so we've seen a lot of that as well. And in fact, when I went to donate blood last week at the Red Cross, they actually had me go through the CDC self-checker, and they also took my temperature. They wouldn't let me in the room until they knew I was afebrile. So there are many different use cases, and really organizations being creative, not just with patients, but like you said, these large health systems, some of them are self-insured, so they have a vested interest in keeping their employees healthy from a financial perspective, but really more importantly from a workforce management perspective, and having clinicians to be on the front lines.
Right. Also, a question came up. Currently, Microsoft is offering the service for free when it comes to COVID, but of course, it would be a fee if the chatbot, of course, deployed in other situations that would be expected, right?
Really for the next 6 months, we're working. So it's March, or no, it's April.
Yeah, it's crazy.
Well, I've seen this meme that it said March goes until March 97th, so I'm not really sure. But we do offer it. We offer actually multiple services right now for free, including Teams usage. Obviously our goal is to get the technology out there, get as many people using it, and getting people what they need. I actually I have a very good friend who's a nurse at Sloan Kettering, and her husband actually happens to be in charge of the outpatient COVID response at Sloan Kettering. And she called me up last Saturday. We had a virtual happy hour. Her husband came home and started telling me all about Teams, completely unsolicited, and really how it's helped them just among the caregivers communicate and collaborate, because obviously that's so critical right now. So there are lots of different tools out there, not just from Microsoft, of course, but a lot of organizations, I feel like, looking to do the right thing. And so, yes, after 6 months, I'm not the pricing expert, but, we have so many customers across the globe that it typically is covered under the EA, the entity license agreement, et cetera.
Thank you for answering that question. I'm curious about some of the other Microsoft technologies. The chatbot by itself is terrific, and we've seen companies like Soul Machines combine a chatbot function with an avatar that also listens in and uses voice recognition tools, also understanding the tone, looking at facial recognition features, and then using that information as well to craft the answer, not just what somebody types, but understanding that person is anxious or upset and able to emote through the avatar to take it to the next level. I know it's kind of next gen stuff, but it'd be kind of cool to hear what you say. I have to think about that.
So yeah, so that is really, I think the emotions and just understanding how that person is feeling, and if we even think about the quadruple aim, regardless of what practice you're in, that fourth component of clinician well-being, especially right now, and clinician burden, I think is critical, because we have partnered with an organization that we actually announced last October called Nuance. Maybe some of you have used their dictation services, but looking at ambient clinical intelligence. And this is actually really a tool that's perfect for practices, so dermatology, orthopedics, et cetera. And it happens that you are able to have that interaction with the clinician, and it's actually an intelligent scribe. It's not a bot, but it is, a step removed from that, and that it's a scribe. So when you're, for example, if you're seeing a patient and you're not sitting in front of a computer, they're listening in, etc. Right. So we did launch that back in October.
And these are virtual scribes. The sit in the room, listen to the conversation, create an outcome.
Intelligence. So it's listening.
Yeah. They're remarkable. There's several companies in that space. We use another one we briefly mentioned yesterday called Robin, and it's similar to Alexa conceptually. It's a device that listens in, takes information that you and I may be sharing colloquially, and then creates a note from that, which then is checked by a human, but nonetheless, they're getting to about, 70% accuracy on the first try. Pretty
Yeah,
amazing.
and that's what this does. And the reason why we, and Microsoft is very partner driven. So, they build on our platform. The reason why we went with Nuance, quite frankly, is because of we were both in tandem developing similar technologies, and it just made sense because we're not a first party solution. We were really behind the scenes. And so working with them, they already had the footprint, quite frankly, in all of these different areas. And so we're doing something we call co-selling with them. So it's been really successful because they do have that base already, and it's really adding another technology in.
Switching briefly to HoloLens 2. In Australia, I understand you're already deploying in the outback with a hospital that's actually bringing holograms into patients' rooms and exchanging visual information. I can imagine that in the context of a COVID, I mean, granted, that is kind of cutting edge technology, but at the end of the day, if you have access to a Wi-Fi and a HoloLens, I could teleport into somebody's room and potentially do an exam. Is that correct?
Yeah, you can. I would say that the use cases I've seen for HoloLens, definitely around, especially in orthopedics, I've seen with pre-surgery teaching, for example, for the patient, the surgeon's able to actually show the patient through the HoloLens what the surgery may look like. There are many companies out there doing virtual surgery assistance, so actually for the surgeon during that surgery period. So I've seen it used in many places like that. But the other area that it's really being used right now is in education, quite frankly, with anatomy and physiology for medical students, for nursing students, et cetera, in lieu of having cadavers and being able to go to a lab right now. I know that Cleveland Clinic is doing that, and there's some other organizations. But HoloLens 2 is deployed all over the world. Think of it as like a wearable computer. So just like with any computer, you're going to need applications and development. So many different organizations create their own applications and develop actually on the HoloLens. Excuse me. So that has been a huge success. But I think to your point, down in Australia, yes, it has the ability to do some things where you wouldn't necessarily need to be live with that patient.
Well, I can also see somebody developing an experience through the HoloLens where you can learn how to intubate people, how to do tracheostomies. When as we run out of healthy providers who can do that technology, teaching somebody how to do an intubation is not the easiest thing in the world. It takes anesthesia a long time. And I would hopefully call upon developers or even you guys to that's one area where we need to show people how to do it. And the HoloLens seems to be a really amazing platform, especially when it's coupled to a physical device and you're projecting onto that space. So
that's a really good point. And I have to look into that because I know that I've been out there. I just signed up for the Medical Reserve Corps here in DC yesterday. I just got my email and ask, and I was trying to put down my specialty areas, and I've actually even watched tutorials online about intubating. Not that I could do it by any means or have the training, but quite frankly, I was like, if I am asked to go in, what do I need to know the most, and how can I support that organization? It's probably not going to be in the intensive care unit for me, but I could go to the NICU, I think. But yeah, the intubation, just the learning tools. I'm actually going to follow up on that because I want to know. I'm sure there's someone out there that's done something, and it's just so vast that it's hard to keep track of everything that's being developed on HoloLens.
On HoloLens, yeah, certainly would be a great service to collect somewhere on the Microsoft website, or let us know how to link to it.
Yeah, we do
teaching tools for that. For anything that's COVID related.
Right. So we do have that comprehensive website that I showed you all at the end. Excuse me, that tech community. I highly recommend you go join it just so you know what's out there. The other thing is you have the ability being part of that community just to hear and see what other people around the world are doing, quite frankly, which is really valuable, because I know it's so important, especially right now. You know, if you're not, the first organization to go through this, maybe you're not Seattle or New York, but you want to know what's worked, what hasn't worked, and how long it's, basically taken to implement. And really back to my pop quiz at the beginning of our session today, thinking about what's been done in the past 7 weeks, 8 weeks, and some of the transformation that I've seen, before, I would say, with a new technology like HoloLens, with the HealthBot, with Teams, with telemedicine, how many people out there weren't using telemedicine 6 months ago, or maybe using it, a little bit, and just to see where you've gone and your comfort level. It's like you have to respond, and you need to jump into the water regardless of how cold it is, and start swimming, quite frankly. So I think that's what I've seen from my perspective, working with health systems over the years. And it doesn't have to be perfect. Obviously, we're dealing with patients and families, et cetera. But from a technology perspective, we have a little bit of room to stumble and to grow. But I think right now, because we're in such a crisis situation, getting it out there and starting with the HealthBot, for example, is just one way to make that difference.
So let's go back to that HealthBot. There's several people asking questions that are more related to deploying a technology, particularly for a smaller facility.
Right.
How does it actually work? How do you get help from Microsoft to get up and going quickly?
Well, a couple things, and I can provide that contact information. We have a general box for HealthBot right now, and they're coming in ASAP and really quick turnarounds. I'm watching it on our internal team site happen all day. Every hour I see another system going live, which is really exciting. And so the HealthBot it's really, our goal right now is to not make you feel like you need to learn how to code or create some type of machine learning algorithm, et cetera. Our goal is to get you up and running. So we have cloud architects, we have technical specialists, we have that entire team surrounding the HealthBot. So if you do know who your Microsoft main person is, I would reach out to them. If you don't, I can provide, I just need to go back into my email and find the email, and I'll put it in the window and I'll send it to you guys of who you can email at Microsoft. It goes into, it's a general email, something like HealthBot at Microsoft, but I want to make sure I have the correct one. And so you can be a solo practitioner. You could be, a small orthopedic practice with 3 physicians, or you could be, HCA or the CDC. We're really looking to help anyone and everyone.
So if you already have a Microsoft partnership, then whoever the lead with that partnership should be able to get you quickly to the chatbot people. If not, I suspect this is hiding in plain sight. In other words, I think a quick search should be able to find you the correct links. And if not, Molly's going to get back to us and see if she can share with us one of the links, and we'll figure out where to put it. Probably on our website at some point. We're going to create a web page with a lot of the links to these presentations and some of these resources. Let me see. I have a question from Dr. Mark Freundsam. How should current smaller startup telehealth tool providers, so smaller startups working in the space, which have solutions, approach health systems to participate in the shift in care delivery? So I guess the question there is, having yourself, your Microsoft, a little harder, do you have any suggestions or recommendations for smaller companies who want to go directly to health systems? It's not really a Microsoft specific question, but
no, it's not. But I've worked with organizations, with health tech companies, from startups. I worked for a startup up in California all the way to, before I came to Microsoft, I worked for Philips Medical and their patient monitoring. So I've worked with organizations with 5 individuals. In fact, I've been talking with one that has 3 here in the DC area, all the way up to, Epic, Cerner, Allscripts, your huge systems. The advantage, and we live and breathe through our partnerships. So, think about the technology that you're built on as the health tech startup. So, for example, what's your cloud technology? Is it Microsoft? Is it Google? Is it Azure? I would actually go back to that particular company that you're built on and see what type of programs they have for their partners. So, for example, they might have a co-marketing or co-sell program, because in the end, it's going to benefit the patients, et cetera, but it's going to benefit your company and then the end tech provider, whether that's Amazon or Google. So, and that's really our approach. We go to market and we co-sell with our for example, like Teladoc. So Teladoc's solution is built on Microsoft Azure. We co-sell, we look at opportunities together. So I would recommend that, especially if you're a small startup looking to get into health systems, because those organizations like Microsoft and AWS have the depth and the breadth, not only in the US, but really around the globe.
Awesome. Great question. Great answer. We're at the end of our session. We could probably go on for another hour. I thoroughly enjoyed this conversation. Thank you, Molly.
Thank you so much. It was great to be here. I got to go find my dog. I think he's scratching at my door. He usually sits right there on my chair. But, hopefully he went to chase the mailman. So thank you so much. I really appreciate the opportunity to be here today, and excited to see how we can contribute to flattening the curve around the world. So thank you.
Awesome. Thank you. And to everybody in the audience, to learn more about what we're doing here at the Digital Orthopedics Conference San Francisco, visit our website at docsf.health, docsf.health. I'm going to close this session and encourage you to stick around and listen to our next session, which will be with Dr. Carlin Center at UCSF, talking about her experience of deploying Zoom to do telehealth visits. With that, I want to thank you, Molly. Thank you so much for being with us, and we'll call it a day.
Thank you. Have a great weekend, everybody. Stay safe.
Stay safe. Bye now.